There are three routine positions for the elbow. The first is the AP. For this position, seat the patient near the end of the radiographic table and low enough to place the shoulder joint, humerus, and elbow joint in the same plane. You want to extend the elbow, supinate the hand, and center the IR to the elbow joint. The humeral epicondyles and the anterior surface of the elbow should be parallel with the plane of the IR. Be sure to supinate the hand to prevent rotation of the bones of the forearm. Direct the central ray perpendicular to the elbow joint and leave collimation 3 inches proximal and distal to the elbow joint with 1 inch on the side. When evaluating the images, the following should be clearly shown. The radial head, neck, and tuberosity should be slightly superimposed over the proximal ulna. The elbow joint should be open and centered to the central ray. There should be no rotation of the humeral epicondyles. Next, we have the AP oblique in lateral rotation. Position the part with the extended AP projection and the center of the midpoint of the IR of the elbow joint. This is very similar to the AP, except you will be rotating the hand laterally or externally to place the posterior surface of the elbow at a 45-degree angle. When positioned properly, the patient's first and second digits often touch the table. The central ray and collimation are the same as for the AP. When evaluating the image, the following should be clearly shown. The radial head, neck, and tuberosity projected free of the ulna. This means there should be no superimposition. And finally, with the lateral, flex the elbow at 90 degrees and place the humerus and the forearm in contact with the table. To obtain a true lateral position of the elbow, adjust the hand in the lateral position as well to ensure that the humeral epicondyles are perpendicular to the plane of the IR. The central ray and collimation, once again, are the same as for the AP and the oblique. When evaluating the image, you should be able to recognize that the elbow is flexed at 90 degrees. There should be superimposition of the humeral epicondyles, and the Leckernon process should be seen in profile.